All right. My name is Michelle. I'll be your student nurse practitioner today, and I understand you're here for a physical today?
Yes.
Okay. Do you have any questions or concerns before we get started?
No.
Okay. So I'll get your vitals, blood pressure, temperature, respirations, heart rate, um, get your weight and height. Just verbalizing about it. We're not actually going to do it. And then I'm kind of just going to kind of work at the top and then go down. And then if you have any concerns or anything like that as we're going, or if you're having any pain while I'm pressing anywhere, please let me know, or any tenderness. Okay. Okay. I'm going to start just by looking at your hair and kind of looking through your scalp. Okay. Alright, everything looks good and healthy there. If I kind of touch around here at all, any pain?
Nope.
Okay, perfect. Alrighty. Any concerns with your eyes or vision? Okay, so we'll start with the smelling test, and that's where we have you look at the letters that hang on the wall, have you cover one eye, read the lowest level that you can read, cover the other eye, and do the same thing. Okay, we're back on doing that. Alrighty, so I'm gonna take the light here and I'm gonna kind of just flash in your eye. I want you to look at my nose the entire time, okay? Alrighty, any discomfort with that?
Nope.
All right, perfect. And then I'm gonna have you look at this object here, and I want you to keep your face center, and I'm going to move the object, and I want just your eyes to follow, okay? Perfect. Alrighty, and then I'm gonna pull down on your eyelids, and I'll have you look up. All right, everything looks good there. And I'm just gonna kind of touch around on your face to feel for any swollen lymph nodes, or if you have any tenderness over your sinuses, let me know, okay? Can I have you open and close your mouth for me? All right, I'm just checking your joint there. Any pain with any of this?
Nope.
All right, perfect. All right, and then I'm just gonna look up your nose. I'll have you tilt your head back. Gonna just look in your nose here. Perfect. And then I want you to plug one side of your nose and breathe in and out. And then do the same thing for the other side. You doing okay with that? Okay, and then I want you to close your eyes. And I'm gonna give you something to smell. Can you tell me what that smells like?
Open.
Okay. You can open your eyes. It was candy. Alrighty. I'm just gonna look. I'm looking at your some symmetry of your face. Can I have you open your mouth for me? I'm just gonna look around. And are you seeing a dental dentist regularly or have any oral concerns?
No.
Okay. Stick your tongue out for me. Say ah.
Um,
Perfect. Tongue up for me. Awesome. Good job. All right. I'm gonna move to your ears here. Just looking at them. Any tenderness if I kind of touch on your ears?
Nope.
Okay, I'm gonna just go ahead and take a peek in your ear here. All right, looks good. Gonna do the same thing on this side. Any tenderness if I'm touching anywhere around there?
Nope.
Okay, good. All right, everything looks good there. The next thing I'm gonna do is have you tilt your head back. This is to look at your thyroid here. I'm gonna have you swallow. Awesome. Okay, and then you're gonna feel my hands here touching the sides of your thyroid. All right, everything feels good. And then I'm gonna just come behind you and you can keep your head straight. And I'm just gonna feel for that thyroid again. Okay, everything feels good and symmetrical. I can't feel any swelling. or anything of that sort. So next I'm gonna just kind of look at your, what we call as your carotid arteries that are in your neck. You have one on each side. And I'm just gonna take a listen to those to make sure that there isn't any what we call bruise or thrills, which can be a disorder if there's buildup starting in those, okay? Alrighty. So I'm just gonna do one side at a time. Alright, that all sounds good. And then I'm gonna have you just kind of turn your head to your right. And then I'm gonna just look at your neck here. And again, I'm just looking, sometimes there can be, if there's a lot of pressure buildup, you can see it kind of throbbing. I'll have you turn your head the other way. Awesome, perfect. Alrighty, just looking at your shoulders here. So I'm just gonna put some pressure on your shoulders, and I want you to shrug your shoulders against me. Good. Any pain with that? Okay. And then I'm gonna put my hands here, and I want you to kind of put your arms out to the side of you. Okay? Good. Any pain with that? Awesome. And then I'll have you put your arms up, down, in front of you, and then can you do a circle? Any pain with any of that? Awesome. Then I'll have you bend your arms, put them back out, and then I want you to kind of bend on me like you're fighting me, and then kind of push me away from you. Good. With your hands, next we're going to check for carpal tunnel. So I'm going to hold on to your wrist, and I just want you to relax it, okay? You're going to feel me thumping here, and I want you to let me know if you have any numbness or tingling in your fingers, okay? So try to relax a little bit. Maybe look that way. Any numbness or tingling with that? Mm-hmm. Okay, and then we're going to check this side. Any numbness or tingling with that? Mm-hmm. Okay, perfect. And then I want you to, it's like a reverse prayer. I want you to put your wrists together just like that. Any pain, numbness, or tingling with that? Mm-hmm. Okay, perfect. All righty, you can go ahead and relax your arms. And then I'm going to start listening to your lungs. Do you have any questions so far? Okay. If you do or you need to take a break at any time, please let me know, okay? Sure. All right, so I'm going to start by doing some assessments on your heart. So I'll start by listening and then touching and feeling for different parts of the heart, okay? Are you okay if I lift your breast a little bit? Sure. Perfect. So next I'm just gonna put my hand on you and feel around for the surrounding part of your heart. Normally we would have you in a gown and dress so we could get a better look, a visual of your body. But for learning purposes, we are gonna have you keep your clothes on. Alrighty. So I am going to put my hand here. And I'm just trying to feel the outer parts of your heart here. Alrighty. And then I'm just gonna lift your breast again here and press for the PMI, which is the strongest part of the heart. Alright, perfect. Alrighty. Next I'm gonna listen to your lungs, okay? Alrighty. Next, I'm just gonna kind of feel around on there, make sure nothing feels abnormal on your red lung area. And then I'm gonna do what's called percussion, and that's going over between your ribs and doing a little tapping motion to see if there's any dullness that would cause concern. Okay? Just gonna start up here by your clavicle and then work my way down. All right, next we're going to do some percussion. So I'm just trying to feel to make sure I'm not going over any ribs. The other side here. Perfect. Next, we're going to move to the back side to listen to you. So I'm just going to turn the chair here. That way they can see what we're doing. Is it okay if I move your hair?
Yes.
Okay. Alrighty. So I'll have you start with some deep breaths. Perfect. Everything sounds good. The next thing I want to do is you're going to feel me place my belt kind of in the same place. And this time I want you to say or I'm sorry, a, when I'm doing it instead of deep breaths, okay? All right, give me a good A.
A, 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 A.
Perfect. Good job. All right, so next I'm going to put my hands down your back as such, and I want you to say 99, 99, 99. So every time you feel me place and lift and place and lift, I want you to say 99, okay? Okay.
99, 99, 99, 99, 99.
Okay, perfect. So now I'm just going to feel and then do that same percussion motion that I did on the front with the tapping, okay? And I do just want to let you know, I did sanitize my hands before, right before entering the room. And then as we were talking and having you change into your pretend gown, I also was sanitizing my hands again. Okay? And I'm going to just go ahead and give you some taps here. All right, perfect. Any pain or tenderness with any of that? Okay, so next what I'm gonna do is testing for what we call CVA. It's where between your vertebrae and kind of your ribs, you're gonna feel my hand there and then kind of a punching sensation. And I want you to tell me if there's any discomfort when I do that, okay? Okay, so I'm just, before I do that, gonna check your spine here, making sure everything looks aligned. Feeling your ribs. Alrighty. So I'm going to place my hand in this little area here, okay? and it's gonna be like a thump, okay? And we're gonna do it on each side. Any pain with that?
Nope.
All right. Any discomfort with that?
No.
Okay, perfect. Alrighty, and your skin so far looks really good. So next that I'm gonna do is test some of your reflexes on your tricep, bicep, and then the brachialis here. And then kind of do some things with your fingers quick, and then we'll move on to your stomach and lower part of the body, okay? Okay. So this is my hammer. So I'm gonna have you kind of lift your arm out like this. You could just do one at a time. And I want you to try to relax as best as you can. So look that way. Think of your favorite, happiest place to be. Perfect. All righty. And we're going to go over to the other side here. Try to relax. Think of your favorite, happiest place. There it is. Okay. So I'm going to pull this down here so I can get in this area. All righty. Try to relax as best as you can. Good. And I'm going to just come down to your wrist here since I'm already here. Try to think of somewhere you'd rather be than here right now. Alrighty. We're going to do the elbow part again. And then we're going to go on to your wrist here. Do you mind pulling up your watch for me a little bit? That works too. Alrighty. Okay, perfect. So the next thing I want you to do is put your arms out in front of you, and then put them up, down, and then I'm just gonna look at your capillary retail. So we put a little bit of pressure on the nail bed and see how quick that color returns. And yours is returning very quickly. You can relax your hands. I'm just going to feel your pulses here. Feel your pulses up here. Okay, perfect. Now I'm going to have you do something that's going to feel a little bit silly, but with your hands on your lap there, I want you to flip your hands from palm down, palm up as quickly as you can. All right, perfect. And then I want you to put your finger on your nose, and I want you to touch my finger, and I want you to follow my finger every time I move it. So it'll be nose, finger, okay? So have you touch my finger, back to your nose. All right, awesome. Good job. And I don't think, I know we talked about why you were here today. And do you know who the president is today? I just want to make sure that we're making sure you're fully alert and oriented.
Trump.
Technically not yet, but
It's not the first.
the 20th he goes into office.
Oh, see, didn't know that.
Okay, that's okay. All right, perfect. So because you're still sitting up, we're just gonna go to your legs. And then once we finish your legs, we'll do your stomach, abdomen area, okay? All righty, so I'm just gonna kind of come down here quick. So I'm gonna just test your strength, and I want you to lift your knees against me when I'm pushing down. Perfect. All right, you can relax. And I want you to kick me away from you. And pull me in towards you. Perfect. And I want you to do the same with this. Perfect. Kick me away. Pull me in towards you. Awesome. And then with your feet, oops. With your feet, I want you to go up to the ceiling, down to the floor. Perfect. And now I'm just going to feel your pulses in the back of your legs. Down by your ankles. Here on your feet. Okay, right, and then what I want you to do is I want you to take the heel of one of your feet and put it to your knee and go all the way down to your ankle. Perfect. And the other one. As best as you can. Great. That was a really good job. Alrighty. The skin on your legs look really good. I'll have you stand up. And I want you to bend your knees like you're marching. And then can you kind of go out to the side, out to the other side. Can you kick back behind you? And with the other leg as well. Perfect. Then what I want you to do is I want you to just take a couple steps one way on your tippy toes and then one way back on your heels. So we'll do your tippy toes. Good. And then come back on your heels. Either way. Okay, perfect. And then what I want you to do is we'll have you close your eyes while you're standing up. And I'm going to have my hands on side of you and just have you stand here for a few minutes and we're just checking your balance. Perfect. I have you open your eyes. And I want you to kind of do a little bit of a squat. Perfect. And then bend over and touch your toes. And this is so I can just look at your spine here, make sure everything looks aligned. Awesome. Alrighty. Oops, sorry. I'll have you have a seat. The only other thing I want to do before you move to the stomach is the hearing test. So this is called a tuning fork. I'm going to hit it and put it on the top of your head, and I want you to tell me when you can't hear it anymore, okay?
Okay.
Alrighty. And then I'm going to hit it again, and I'm going to put it behind your ear here. And I want you to tell me you can't hear it anymore, and then I'm going to move it here, and I want you to tell me you can't hear it anymore. Okay?
Okay.
Can you still hear it?
Nope.
Okay. And then do the same on the side. That's 1 minute.
Okay. Okay.
Perfect. Alrighty. So next I'm going to listen to your stomach. Alrighty, so first I'm just going to listen to your bowel sounds and then I'm going to listen to your different arteries, okay? Alrighty, now I'm listening to the arteries. Your bowel sounds sound good. Alrighty. Alrighty, next I'm just gonna feel around, okay? Any pain with any of that?
Nope.
Okay. So next what I'm gonna do is called McBurney's point. I'm gonna apply some pressure here and I want you to tell me if you have any pain. This is just testing for appendicitis, okay? I'm gonna go ahead and put some pressure here and then release. Any pain with that?
Nope.
Okay, perfect. And then I'm gonna have you kind of roll on your side. I'm sorry, that way. Alrighty. And then I'm gonna take your leg here and I'm gonna pull it back towards me. Do you feel any pain at all? Okay, perfect. Alrighty. I will have you roll back over on your back. I'm going to just kind of feel around for any fluid in there. And then I'm just going to feel around for your liver and spleen. Alrighty. All right, everything there feels good. All right, we can have you sit up. And that kind of concludes our head to toe physical assessment. Do you have any questions for me?
Nope.
All right, well, thank you so much.